I had booked myself into a rehab place for about a week or 10 days after the operation. Probably the greatest benefit was living in and doing that physio and working hard at it. Great carers push you, but you need to be pushed to make sure it works. And usually in the afternoon we went back to the pool for an hour of hydrophysio, which I felt was probably of greater benefit than anything else, because the pain isn't as bad as being physically pushed inside a gym.
And then off to rehab, which was a hospital about only a couple of mile away from where we were. And they don't want you in bed. Get up out of bed, sit in a chair, learn to do everything yourself. You go from the frame to a walking stick to just getting around yourself and doing a lot of exercise and gym work and pool work there, which was 7 days a week. And I was there for 2 weeks. And then after that I was out of there, but they brought me back 3 days a week to the rehab, which I still did for probably another 4.
And after that 2 weeks living in, I then went back to physio for another 6 weeks, 3 days a week. So probably 9-10 weeks of physio, fairly intense physio altogether. And within 2.5 to 3 months, I was back playing golf.
I was fortunate enough to stay in a private hospital that had its own rehab unit. I was an inpatient and did rehab for 14 days. I was then discharged from the hospital and I came back 3 times a week. What they did, they've given me a schedule of exercises to do at home on a regular basis, which I do. And subsequently I've lost 12 kilos since the surgery.
I probably was a little bit too anxious early after the op to sort of get back to out doing things in the golf course and walking and so on. And I've had to sort of ease up a bit because I tried to do a couple of things too early, and he said to me, don't, be patient.
About every month you can say, okay, the swelling's a little bit less, the movement's a little bit more, the discomfort's a little bit less. Just got to be patient. I know that because of the progress I'm making, that in a short period of time, I'll be good as gold.
I still get some pain, but very minor compared to what I ever had. And no pain where I have to take tablets.
It was very, very, very successful. I can now walk up hills, I can now go and play golf, I'm now out of pain. The key to survival and the key to healing properly is the physio. You're not going to heal if you don't get in and do the physio.
And you should ask a lot of questions of a lot of people and make sure you don't have any questions left and any anxiety.
The people all play their part, obviously, and the physio and doctors and so on, but you've sort of got to do your bit too. And I'm glad I listened to them all, and I'm glad I sort of did my little bit too. And as it worked out, it's good at the moment. So I'm happy for me, and I'm happy for the rest too. I hope they are.
Be positive. Go forward.